Good morning, and thank you so much for agreeing to do this. We really appreciate it.
Good morning. You're welcome. It's been my pleasure. Thank you for asking me.
Not just with our center, but in healthcare in general. Can you share your perspective about how healthcare falls short in providing equal access for those with disabilities that we would think is the obvious that healthcare should be good at it, but it's not? And your perspective on that?
For me personally, it's a matter of accommodations. When I make a request for an accommodation, it's never granted. I have to make, at least not on the first request, I have to make multiple requests. And it seems like healthcare people feel like they know better what I need or what would work better, and a communication breakdown. And it seems like that's mimicked by what I experienced, like upon check-in. I'll tell somebody at the front desk something I need, like an accommodation, such as, I can't hear, so I'm going to need you to communicate in writing. But that's also serves multiple purposes, because it's not just because I can't hear, it's also a matter of now a processing issue. And I feel like in order to get people to understand why I need an accommodation, I'm forced to give up information that I shouldn't really have to.
Right.
And I really have to, like, even down to the people that are supposed to be advocating for me, I still have to kind of advocate for myself. Right now, I'm going through disability hearing, and even the Office of Hearings, it's supposed to be assessing me personally. They only have interpreters. I'm not ASL fluent enough for, I can converse for like basic, give you directions, say hi, that kind of stuff, basic information. I can't follow for like medical terminology, but that's the only option. So it's always making a request and not being heard, people thinking they know better, and having to let them figure out, okay, I'm going to have to, in order for my own sanity, I just have to let them say, okay, I'm with a person who doesn't recognize that I deal with this day in and day out. So I know the logistics of it. I've tried, and I know what works and doesn't work. And I know that what seems like it works actually doesn't in real life. If I try to take control, my experience, my facial expressions don't match the hearing culture. And people are not aware that there is a hearing culture versus a deaf culture. So this look on my face is always what I have. And I get accused of being aggressive or angry or having an attitude. Like, none of those things exist at the time I get accused of them, but being accused of that then creates them all. And like, I understand, because on healthcare side, they're used to people who can't advocate for themselves, don't know how to explain, but people who are in a disability situation go through this every day. It's a repeat experience. For you guys, it's isolated somewhat.
Yeah.
But for us, it's like a thing. And I feel like there's a lack of trust involved. Like, we really know what we're talking about. And
you're really the expert in it because you're dealing with it every day.
Right. I mean, and I get to both sides, because I've been being a retired massage therapist. I know that there's people who come in and they're not really medically minded. And there is a certain amount of professional standpoint. They do have to seize control of the interaction most times. But I feel like there is not enough awareness for when that's not necessary. Like, they just fall into a rut. And I know it's just, you know what I mean? The pressure gets too much, and it's day in, day out. And, that's a whole different thing.
Just thinking of what you were just saying, tell me some triggers that you hear staff tell you that you're just like, are you kidding me? In other words, you're trying to say, here's what I need, or here's what the requirements are. And they say things like,
I'd say the first thing is when, the very first thing is when I walk in and explain to them that in whatever way I use either my talk to text app, or I try not to verbally say it, because that messes with people. If I talk, they think I can hear. the same way. So, and that I'm hearing culture, and it doesn't, it really messes with them to not be able. So I try to give them the full deaf experience and just take my voice out of it. Plus everybody's always telling me it's not what I say, but how I say it. So that tends to solve that. But when I walk in and indicate that I will need an accommodation, literally every time it's okay. And then nothing changes. They just completely do that. Their behavior is unaltered. They still try to talk to me. I can tell that it doesn't register in any way how it will need to play out, like what different things they want to offer me, phone numbers instead of emails. And just everything is centered around the hearing. Even when I ask for an accommodation, they generally try to enhance the hearing part of it, because I do have some residual hearing, but mine is progressive. So I had a lot more when I was a child, and I don't now. So there's a certain amount of adjustments I'm in the process of learning how to make. And my old coping mechanisms are starting to fail, and I'm trying to figure out. So all of this is going on. And then, like, the things that I do know work for me, I'm like, okay, it's going to be a fight with this to get them to understand. And so I just, when I immediately don't get an accommodation, I tend to not allow the interaction to progress. I have to stop and say, I need you to write, please, and get them to understand. Because if they don't make that mental shift, I can't. You know what I mean? It's just everything that I do is going to be interpreted. If I start signing or anything like that, it's going to be interpreted as aggressive, as stressful. They're going to start telling me to calm down. I need to change my attitude, all of that stuff. And then the interaction just kind of falls apart from there. And no matter, and I'm not believed when I say that I'm not doing that, or I don't feel that way. And part of that I know is because of the pituitary thing. In my therapeutic session, I tend to have, like, I don't know if they're emotional releases, but I tell him, I'm like, I'll be crying. And I'm like, this is not accurately indicative of what I'm feeling right now, but I can't control it. You know what I mean?
Sure.
Literally. And there's not anything I can do about it. But again, there's the lack of belief on the other end. And I really think it's, they just don't know how to respond. They don't know what to do with it. You know what I mean? And the information I give them, it's like, okay, well, what do I do with this?
You made a really good point on here. We frustrate you by not providing the accommodation, and then we want you not to be frustrated or upset by it. What do you tell staff on how to change their mindset to start listening and realizing the only way to remedy this is to be a good, active listener and follow what the patient is directing us and saying, I need X, Y, and Z?
Well, it depends on their receptiveness. Some people just can't be taught. And being able to recognize that, I think, is a big time, because some people tend to be like, oh, they can be taught and coached through this. And some people just won't, and they don't belong there. But people who are receptive, it works best when I explain that there is actually a hearing culture and a deaf culture. And that it takes a lot of education, and usually more time than I have to educate them. But there are actually a couple of different things. People don't understand what deaf is, and they don't understand that it's a different culture altogether, that it's not necessarily a disability like they think, except for when I try to function in a hearing world. Mm-hmm. I didn't know growing up that I was raised in a blended culture. And so I ended up having deaf expectations of hearing people and not understanding why they were. And I've recently learned that. So being able to tell people, I'm not being rude and I'm not being aggressive, I'm just being deaf, and explaining the differences between the cultures. Like, there's certain number of things that deaf people are direct, to the point that hearing people generally are offended. Mm-hmm. When you are describing someone in ASL, you're talking about, you describe them as fat. If they are, I would be described as, type of thing. You develop a different sense of, it's not necessarily thick skinned, because I'm definitely not in the hearing culture. But in the deaf culture, I'm not offended because I understand the culture, and so in the same, if a hearing person called me fat, I'd be probably offended. Deaf person calls me fat, I know they're probably just describing me to someone else. We point, you know what I mean? A lot of things. And it doesn't work out when I didn't realize I was verbalizing that. And so I'm going like, why are you offended?
Right.
And they're going, oh my God, can you believe she just say anything? You know what I mean? So there is, when I let them know that there's an actual culture and can get them to believe it, then they're like, okay. And I'm like, really? There are certain things that I need. I need you to not be backlit. I need you to talk slower. I need you to, if we're going to talk and all this sort of thing, I try to explain to them, you want me to lip read, but lip reading is one of the, first of all, watch those bad lip reading videos. They're funny. They're also exactly what lip reading is like. There's so many variations. It's one of the best ways to be misunderstood. If I know you, that's a different story. Think about the game charades. Think about who you pick to be your partner. Generally speaking, it's someone who knows you the best, who's not going to misinterpret you, right? That's what you're asking me to be, is your charade partner during that. And I don't know you. You can project what I know exactly the experience that they're having. They can project what they're thinking. And I literally see, it's really funny actually for me, because I can see you thinking so hard, like, and I'm trying not to laugh because I'm going, right, okay, so I know that they want to check my temperature. But when I tell people that, I need you to do stuff, they're just like, I get this whole Vanna White thing. Like they check in, they got their little temperature gun and they're like, and I mean, generally speaking, in the context of things, that could be a million different things. You want me to take your temperature? Are you gonna, what? Right. So it's just in the context of putting it into context of charades really generally tries to help. I have to make a relatable cultural context for them, for the education to sink in and take. But if they're not receptive to it, and most people don't want to be educated, and they definitely, I'm sure I come across that way, it shuts down the receptiveness too. So, if they can maybe just actually hear beyond my behavior, don't take it, it's like raising kids. You can't take everything they do personal. You know what I mean?
Yeah.
If you do, you'll probably lose your mind. And that's kind of where I'm at. But so relatable experiences for them, explaining that it's a cultural difference, is explaining the different things. I'm direct. I don't mean to be, but it's a cultural thing. And I'm going to ask a million questions, because one thing they don't realize is that hearing people have a constant influx of information. There's a lack of awareness about that. They don't realize they have that constant stream of information, because your brain learns to filter that out as you're growing up. And it's not a conscious process necessarily, but information, I think what the biggest problem is people can tell I'm not dumb, but I'm asking questions they consider to be dumb or like I should know. And it's because they seem to be common knowledge questions, but they are things that have been, they've gotten from years of experience and all this. My experience is that every place operates a little bit differently.
Right.
I'm going to ask you a million questions so that I can learn your individual procedures, so that I know what to anticipate, how to essentially work the system, because it's going to have to come to that. I'm going to have to know who to contact for what information, who is willing to give me information, who not to bother, all of those little intricacies, because I don't have that. Letting people know that they have that auditory, I don't even know what to call it, avenue or whatever, is so enlightening for them. Because I'm like, okay, just when you got that information that you expect me to have, if I ask them, where did you get that information from? And it redirects their awareness and then starts to create that. And they have to then think about it. And it's like, I don't know. It's like, okay. So, but if you didn't know that, you wouldn't know who to ask for that information, would you? And you would ask the nearest person who seemed to have a clue. But you want to crucify me for that.
Right. Yeah. These are great analogies. I love your analogy on reading lips from someone that you know versus someone that you don't know, and charades. I mean, that is, to me, that is a really powerful analogy, because I think, yeah, people just make an assumption, and you're trying to figure this out and communicate already in a complex world of healthcare. And then the other part, when you said people that don't want to learn, I have seen people. I've seen people that think that they know what's better for someone than the person does, instead of how do we, it's like the golden rule. They say, do to others as you want them to do to you, but really it's do to others what they want done to them.
Yeah, really.
You know what I mean? It's a very stark contrast. So I think that's really, really powerful. Tell me about with staff. So let's just say staff are going to watch this video. What would you say to them to help them to be mindful? Because what I look at is what you're sharing, to me, helps deepen a provider's skill that isn't just helpful to you, it's helpful with all patients, because it's getting them to stop taking things for granted and to really listen to patients and things like that. What would you say to get them to not let this be forgotten weeks after they see it? In other words, to put it into practice so they actually are mindful of it every patient, every time.
I guess I would just have to reiterate what I have already said. Please try to, if you're hearing anything, please try to hear past any bad behavior. Mm-hmm. If we are acting up, I'm sorry, this one's hitting. Anytime we're freaking out, it's an alarm. Mm-hmm. Okay? It's not personal. It's a plea. It's a cry. We're begging for help. Everyone else has done to us, or we've just hit our limit for whatever reason. It can be any number of things, but it's probably, really honestly, if you have a choice to take it personal or not, choose to take it personally, to be our advocate, please, because we're not after you. We're just trying to get help.
I think that's so well said. I think that's so well said, because I think that's what people forget, in healthcare, is people are coming because they're in a bad place. They have a need. And so we're all going to be in that position one way or another throughout our life. And so providers have to be able to say, I want to be known for advocating, for this patient. I know my mom passed away a few years ago, and there was all sorts of medical errors involved in it. And a lot of it was no one listening. And, I'm in healthcare. I have sisters that are in healthcare. My brother's a firefighter. All of us felt helpless in the health system in Colorado, because everybody just smiled and said, oh, we're, just stay strong, and all the nice little things to say. But the reality was nothing changed. My mom, they were supposed to do a paracentesis to remove fluid from her lungs, and it took them 18 days, I believe, to do it. They removed like 2.5 liters, and we were every day saying, when can someone do what they said they were going to do? Look at the pain she's in. So for me, this is so passionate, because I've seen firsthand many different cases where we fall short. And it's like, healthcare staff have to realize this is a high calling. And to be able to be at this high calling is to set ourselves aside and say, when people come to us, like, I love what you said, see past any kind of behavior, because when someone's in a bad place, we're not always at our best, because we're hurting, we're frustrated, all those things.
Yeah.
I just appreciate your just being real with that. The other thing I was thinking is, what do you see as IT issues? Because I know we've had issues in the past where you've seen things like, via phone, email. What are the technology items that you can think of that are still not where they should be in healthcare?
I've been waiting for this one.
Good.
So chats actually for people like me are awesome. They don't work so well for my quadriplegic because we can't. He uses Dragon, which is fine, but he can't if he is trying to communicate on his own. He can't refresh the screen or really, you know what I mean? Sometimes he can if I put him in front and give him his little stylus. Mm-hmm. So I don't know that there's anything you can do about that. For me personally, TTY, everybody wants to give me phone numbers, which, okay, fine. But don't get mad that the TTY stuff doesn't work or the relay is frustrating, because it's just as frustrating for me, but you only have to deal with it when it comes to me. So TTY with that, if there were specifically, it's all the menus. There needs to be, if you're going to give me a TTY friendly number or relay friendly number, it needs to bypass, just go right to a person. Don't give me, because what happens, like people don't understand what it takes to use the relay service. They don't even know how to use it. First of all, you have to dial 711 and then give the operator the number. Anybody can use this. And actually it is pretty helpful service. So even older people and all that, that have a little harder time dealing with stuff. But then when you ask the person, when the call assistant is trying to get through the menu, they got to wait for the whole menu to come out, type it all up, they disconnect. So after every single option, they're disconnecting. I'm telling, they have to write it down, remember, or whatever, and then call back. And it has taken me 47 minutes just to get through some menus.
Yeah.
Trying to before I can even get into somebody's queue. And then it takes like an hour and a half wait or whatever. So people tell me to call. It literally takes all day for a deaf person. That's another reason why it's like, don't just tell me to call.
Right.
Email seems to be much faster and preferable for me. Texting doesn't seem to be an issue. It doesn't seem to be a capability that they have enough of, or that is, and I'm sure there's some legalities with that.
Right.
But I know email is considered a legal document and can cover those bases. So I guess just defaulting to the habit there, the transfer of information seems to be the biggest thing. And I think it's an IT thing on the back end, because if I give someone some information, not only do they not know what to do with it, but they don't seem to know how to utilize it in I'm like, because I tell them, I'm like, well, can you note that in the system or something? Like, what electronic means are available to you to utilize it? And I don't think they know. I always, as an employee, always played around with that to see what systems could do. And I knew stuff that my managers didn't know the system could do, and would be like, are you aware of this? Because, but so there are some capabilities, and that I think the other thing is like, being able to, I had how many numbers you didn't have enough fields or whatever to put in texting numbers and numbers to call. And I know that's a nightmare. So I think we tend to have a bigger volume of information that needs to be stored and transferred. And logistically, that's got to be a nightmare. But apps are largely helpful. I usually, like right now, I'm also running a captioning app also in addition to this, which is why I keep looking off camera and all. But they're not be all end all, especially auto-generated captions don't work as well as people think they do. So there needs to be alternative non-hearing methods available.
It's almost, hearing you talk about that almost makes me want to put a simulation together for staff and have them be in your shoes and say, I want you to try to communicate this way. And then when you're frustrated after hours, and then I look at you strange, like, well, relax, because I don't know you've been dealing with this. How does that feel for you? I'm just almost thinking in my mind, it would be kind of cool to set up a simulation for others to experience what you experience, because I think that's a huge issue. They're thinking, oh, you're right now we're just talking. Meanwhile, you're having to go through all sorts of things that they're not aware of that frustrate the communication. You know, just like you said with subtitles as well that aren't accurate. So they think you understood, but what that showed was something different, a different word that sounded like it, of how we can do that.
I have suggestions if you want to do that.
Yes.
First off, there's a video. If you'd like, I can send you the link. John
Yes.
Barrowman is an actor that they did that to. And he has he was like, oh my God, the experience was just, he's like, people changed their attitudes towards me and all sorts of stuff, and anger, the amount of anger. What they did is, you know, when they take molds for your hearing aids and they fill your ear, fill them with that stuff, because that's exactly what they did. They stick the cotton in there. You can't hear. You know what I mean? You're pretty deaf. You're not completely deaf, but you're
impaired, definitely
enough to, and have them go through, even just experience and try it yourself and see how it goes. Yes. You know what I mean? Just see how people respond to you differently, and all the different, because again, there's a million little things that go on in any different time. And even though I experience it every single day, I'm still forgetting all these little things. But John Barrowman's YouTube video was very powerful on that, and explaining, not so much watching, but like the end of it, the explanation of his experience. He was like, people I knew my whole life. He was like, I was trying to help and they wouldn't let me. They excluded, they isolated, all that kind of stuff. He said, I had a paper in my hand and my producer was like, give me the paper. And I couldn't understand him. I was like, what? And he was like, oh, never mind. It just snatched it out of his hand. And I'm like, really? And so even if you don't get to actually have them experience it all, it's like a 5-minute.
John Barrowman became deaf for a day to find out what life was like affected by hearing loss.
What it feels like is everything's just blocked. I'm gonna go and experience some of my day.
It is going to be a shock to the system.
Can you help me across the street?
Yeah, sure.
I'm not blind, I'm deaf, but I feel really a bit insecure.
Hello? Hello?
Hello, Katie?
Hi.
Katie, buzz the door again. Okay.
Did it hurt your ears putting them in?
No.
No?
What?
You keep looking at me. It's
I know, because
odd.
I have to look at your mouth.
Hello,
Hi.
John. This is Robin.
Hi, Robin. Hello, puppy. Hello. I'm feeling frustrated, and I feel like I just want to sit down, shut my eyes, and go to sleep for a while.
Yeah.
Right? How is this going to change and help me?
When a sounder goes off, then Robin was going to come over and alert you.
First up, I was alerted to the telephone. What is it?
Let's talk about the experience as a whole, because it must have been an extraordinary thing to go through.
It was, and I said there, it was very isolating. All of a sudden, the things that I knew, the things that were so normal to us, hearing people, all of a sudden they were gone. And the fact that, you know, the day progressed, as it progressed, it got worse. I felt more withdrawn, more isolated. People started treating me so differently. Really? Yeah, and people that I have known for years and people that I have worked with for years. It was just unbelievable.
How?
Well, for instance, if you were me and you have that piece of paper and you were trying to, you just keep saying to me, what? Oh, give it to me. That was what my manager Gavin did to me.
So he was saying, can you pass the paper, and you couldn't.
Yeah, he was like saying, you know, Phil, do this, and I was saying, what? And he was like, oh, just give it to me, I'll do it. And I was like, whoa. The normal work process, which I've been doing for 28 years, as you guys know, we work in the television industry. I know about camera shots, I know about things when we're out on an OB and we're filming outside. The camera, crew were discussing something, and I knew I could help them. I tried to help them. I was saying hello, and they literally were going, just stay there, just wait, we'll deal with it. Wouldn't let me contribute anymore, and that's why when I said I feel like I just need to sit back, and I want to go to sleep, and I want to sit for 2 hours.
Did it make you feel depressed?
It made me feel, me personally, it made me feel upset and angry. I'm not deaf, okay? And even with the blockage in the ear to make me deaf for the day, you know, I don't experience what deaf people do every day, but to get that snippet of it, it was just unbelievable. It was really an eye-opener for me.
We have to mechanically get people to feel what you're feeling as far as the limitations that go on.
Well, in behaviorism, they want me to behave a certain way. Well, you don't have to have that look on your face. This look is, I'm trying to concentrate. I'm trying to figure out what you're saying. It's confusing.
Yeah, it's an inquisitive look.
I actually have to have that look on my face because I can't concentrate and not have that look on my face.
Well, to me, it's like an inquisitive look. Like I'm not, something's not making sense to me. This is not making sense, you know, because it's almost like you expect it everywhere you go because it's so bad. Because
I do.
Yeah.
It's not almost like I do. I prep for it. I literally have like PTSD. I will die before I will choose to be treated by anybody because they don't get it. It's just, and that's just the service dog things. Like people, I get that. People, the service dog, they can't not violate. They're so used to, oh, puppy, and they can't not look, but they don't get that even staring. You can feel the weight of someone staring at you, right? So that's a friggin' distraction to the dog too. And you wouldn't act that way if I rolled in here in a wheelchair. And I know that because I roll in here with a guy in a wheelchair, and you're not asking him the make and model of his wheelchair, but you're asking me the breed and name of my dog, which first off, I can't even answer you on that because saying his name is a distraction. And secondly, why do you need that information? You will never have a cause to use it. Do you just want to make polite information, polite talk and small talk about something you think is cute? That is calling attention to my disability, to something that I need, and it's not something I want to talk about. Again, it's an isolated incident for you. I deal with that all day. I can't, if I stop, it's like being a celebrity. If I stopped and talked to everybody and let them pet and all that stuff all day, I would never get anything done. Plus my dog would be sick because people have stuff all over their hands, and that's why dogs can't lick. And no, you can't give him a treat either. So try to get them to comply with that. Nobody does. You have ADA laws, they're like, okay, you and whose army is going to make me do it? Because they know that A, you're going to have to go through the legal system, and B, it's probably not a serious enough violation, and C, even if you do win, it's years down the road. So there's nothing they can do about, you're still going to have to suffer the humiliation, the injustice, or whatever it is now.
Now, I think it's clear. Now, so give me 4 bullets staff should do when they encounter seeing a service animal that don't do this, give me 4 strong ones that they can remember. No
eye contact, no talking to the dog. Basically, don't acknowledge the animal. And if you want to, so don't acknowledge the animal anyway. No talking, no touching, no staring, any of that. Don't ask me questions about him. And it's okay. We get, if you have to look to, first of all, you should look to acknowledge, to see that the dog is there. Abide by the vest. Stare. I will let you stare if I see you are reading what his patches on his vest say, but I will hold you to it. I will correct you, and I expect to not be vilified for that because it's you being the jerk. And don't give me attitude. Like, the proper response is, I apologize, and stop doing it.
Right. Yeah.
Because you're
apologizing every time
nothing without changed behavior.
So really, I think a good summing it up would be, number one, it's okay to validate, oh, this is a service animal by identifying the vest, and then really pretend that the animal is not even there, because the animal is a tool for you, not a pet for everybody else.
Exactly. They're not a pet. They are a medical,
they're a resource, right? They're assisted tool. Yeah.
Treat them like my hearing aids.
There you go. That's a good analogy.
Okay. Well, I have right on his service vest a patch that says, "Would you ask to pet my wheelchair?" Well, and I also have another one that says, "Staring is rude," with big old eyes. And I mean, really, I spent a lot of money on these patches and stuff that say, "Don't talk, don't touch, don't stare, no eye contact." In Spanish, I have them on there. I have a little candy heart, like those, sweetheart Valentine heart, that say, "Go away." You really, it's saying.
I can imagine that when people start talking all this, and you're just trying to get to where you're going without all the interruptions, you know? No, I think that people, I know this has been a good experience for me hearing you. You and I've talked before, but to hear you with all these analogies really helps clarify so much in my mind that I think it is going to have a lot of impact on staff. And having this dialogue where you can champion these causes for other people that are not as articulate and willing as you are to be bold about this stuff. A lot of people are afraid to speak up.
I can thank my mother for that, actually. And you guys had the pleasure of meeting her.
Yes.
Growing up, she conditioned us. You let people know you cannot hear, you tell them what you need, and you don't accept that you are less for that.
And I think those three things is an important message for everybody to understand, that's reality, it's truth, and people need to respect that.
We all need reminders, though, too, because we're all human. And I definitely suffer from that as much as anybody else does. So I always try to remember, another thing she said is when you point a finger, you got three more pointing back at yourself.
Yeah.
And we're all on that. But thank you for this. And just to say, follow up and follow through is definitely as important to me as anything else, because that tends to be where things drop off.
I appreciate it because you're giving me the tool to put truth in front of people that they have to reflect on. And I thought this, or I thought that, these misconceptions. And I think that's kind of where it starts for people to say, I actually have to listen because I don't know. That we have to listen. The patient knows their body better than anybody. And so even in diagnosis, we have to listen to the voice of the patient. We have to allow that to be amplified in every way we can. And we have to allow patients to help us keep them safe. And that only comes by listening and listening and more listening. So I'm grateful for you.
It's a teamwork thing. They got to, you have the expertise, but we have the other expertise, and it's got to go together.
Yes.
But